through the MRI image portion of the lecture. So this first image you see here is a T1 image. So it's showing the anatomy and it shows the bony detail in better quality. This one over here is a T2, which is showing the pathology a little bit better. So if you look closely at the images, and I know they're not the best on this computer, you can't see as much detail in the bone, such as this body of the cervical spine, as you can in the body of this cervical spine, because this one's focusing more on the anatomy and this one's focusing more on the pathology, so they're not going to give you as good bony detail. So this is also a sagittal view or a side view of the cervical spine and the thoracic spine, along with the spinal cord and cerebrospinal fluid that surrounds it. So you can see here on the T2 that fluid is white, the fluid surrounding the spinal cord, and it's black on the T1 weighted image. So this is also a T2 weighted image, and again I can tell because the cerebrospinal fluid is white. But this is a patient that has a cervical spine fracture. So we're looking at the cervical spine here, and you can see here that the cervical spine is fractured and it's actually pushing posteriorly into the spinal cord. This is an image of aortic coarctation, is how it's pronounced, coarctation. So you can see here, this is that actual diagram of the heart where you can see it. So the aorta comes up here, comes down, and then there's this narrowing right here. So here's the aorta coming down, and you've got that narrowing right there on the MRI image. So that's exactly what coarctation is. It's narrowing of the large blood vessel or the aorta that leads from the heart. So what happens when you have a coarctation like that is it makes the heart actually pump harder to push the blood through that narrowing. So it's usually present at birth, which means it's a congenital defect, and it may occur along with other types of heart defects. Treatment for that is a stent or a catheter. This is a 39-year-old female patient with liposarcoma. Liposarcoma is a rare type of cancer that begins in the fat cells. So you can see on this image here, this is a T1 weighted image, and you can kind of see the liposarcoma right here. But when they use a fat saturation technique, you can see the liposarcoma. It stands out so much better in that. So the fat saturation actually gets rid of the fat or changes the fat to black on the image to better see any abnormalities. So this is an 11-year-old male that has pilocytic astrocytoma. So what that is it's a benign brain tumor that originates from these star-shaped cells that are called astrocytes. So they're very slow growing and they're also very treatable, which is a good case scenario. So this patient has a mass in their brain. So that's really, the contrast, there is contrast around there. That's what this white is. So if the contrast is just surrounding the mass like this, that means the mass doesn't usually have blood flow, which is usually an indication that this is just a cyst. If contrast is filling the entire mass, that means it has blood flow, which is usually an indication of cancer. So this white area here, you can see this is kind of leading to that. This white area here in the brain is a sign of stroke. It's showing the damage from a stroke. This is the left side of the brain, this is the right side of the brain. So if a stroke occurs on the left side, this can lead to paralysis on the right side of the body, and it can also lead to speech and language problems. So the effects of the stroke kind of depend on how much of the brain tissue is affected and what part of the brain that the stroke occurred in. So this is a meningioma. So on this image over here, this is before we used contrast on the patient. So it's really hard to see anything that's going on. If you look, here's this meningioma. There's some issues going on over here and here. You can't really see any of them on this prior scan. So a lot of patients can be misdiagnosed without the proper scan if they're not using contrast when they should, and so on and so forth. Um, Meningioma is usually a non-cancerous tumor. It comes from the membrane surrounding the brain and spinal cord. They are very hard to visualize without contrast, which you can see here on these scans. This is a coronal slice of the brain. This could be a couple things. I can't say 100% without having additional views, but it could be fluid. Remember, on a T2 scan, fluid is black, or I'm sorry, a T1. And then it could also be a tumor with fluid around it. As you can see here, there's that midline of the brain, and see how it's pushing it all over due to whatever it is, if it's the fluid or the mass in there. This is a thyroid tumor, so if you're looking at this image here, if it's hard to kind of tell, here's the base of the skull, and here is the C2 vertebrae right here in the dens, and then you're coming down here, and here is this big tumor on the thyroid. So it's actually very large. These are what we call compression fractures. So compression fractures can happen in elderly patients without really much damage. It's usually from the impact, either sometimes just falling on your butt, it can compress the spine, or falling and hitting, the top of your head. So either one of those, what it does is it pushes the spine together and it can cause that compression fracture. They tend to be more common in elderly patients, but we can see them in younger patients due to trauma. This is a patient laying down with a conventional MRI. You can see right here that this patient has like kind of a bulging disc. So this is the disc space here in between the body of the vertebrae. And see how it's bulged out into the spinal fluid right here. So that's kind of, you look at this and you're like, oh, well, that patient kind of has a herniated disc. Then when the patient stands up for an upright MRI, you can see that there's a clear shift and there's a lot more going on here. So sometimes with the patient weight bearing, you're going to get different views of the anatomy. Now, weight bearing MRIs are not very common. Usually spine clinics would have them. These are what they look like. These are an open MRI again, and they're multi-positional. So you can sit, stand, lay down kind of at an angle, lean forward for flexion. It just depends on what the doctor is trying to look at. And again, here's another view with that patient sitting. But again, you can get a different view of the spine in the upright position, which may show you different pathology. This is just a coronal slice of the chest and abdomen. So you can see the lungs. You can see the airway here where it bifurcates into both of the lungs. You can see the liver and some of the intestines here, both the head of the humerus and the muscle surrounding it. There's not really any abnormalities in this one. The patient has gallstones. So here's the gallbladder right here, and all of these little white dots in there are gallstones. Those are actually really hard to see on x-ray without any form of contrast. So with MRI, it's easier to depict the gallstones. This is a mass in the bladder, so you can see these little white arrowheads are kind of pointing all around it. So it's all this darker area right here. It's invading the bladder posteriorly and to the right. So here's your bladder. See how it's kind of pushing on it? Well, not your bladder, but someone's bladder. This is an MRA, remember, magnetic resonance angiography. So we're looking at the blood vessels. So these are really good to see if there's any strictures or aneurysms or things like that without having that lengthy exam and a lot of contrast. This is another form of angiography, so they're looking at the carotid arteries here on both sides. And again, the blood vessels in the brain for MRA. This is a 48-year-old patient that complained of shoulder and back pain. So you can see here they've got a soft tissue mass at the level of T6. And then at T11, they have right here in this little spot here, they have a hemangioma. A spinal hemangioma is a benign tumor usually, but it's most commonly seen in the mid-thoracic or lower lumbar spine. This is an 85-year-old female patient with right hemiplasia. So hemiplasia is muscle weakness or paralysis on one side of the body. So this patient had a CT scan prior to this MRI and it was actually normal. So, depending on what we're looking at, you know, sometimes it's better to have an MRI versus a CT scan. But this patient actually has fluid in the ventricles. That's what the white is here. So this is what metal artifacts look like. Remember when I said it's like a black hole? So this patient has a artificial hip replacement. So you can kind of see the outline of where the hip is, like the femur here, like on this one. But because that was made of metal, it shows that black hole. Same thing here. This patient actually, this is a head, brain back here, front of the face. This patient has braces. So you can see kind of the outline of the teeth. This where their braces would be. So it's just kind of the black hole. This is a newborn baby with nephroma. So nephromas are kidney tumors. They did find these tumors on the OB ultrasound, so you can kind of see here how, this is a large tumor. And then over here on this side. This is a lymphoma in the humerus. So you can see it here on general x-ray, you can kind of see a darkening area here in the humerus, which is, usually they're unable to determine what exactly it is, so they'll ask for additional imaging. In this case, they asked for an MRI, and you can see here and here in the different sequences. The lymphoma of the bone is a rare type of cancer that actually starts in the bones instead of the lymph nodes. Again, this patient had a general x-ray, and you could kind of see something was going on here, but they had to do an MRI. Obviously, in the MRI, you can see this in much better detail. It's an enchondroma, which is a benign cartilaginous lesion. So it's non-cancerous, but it can cause pain, going on, especially if the person is active. But a lot of times this is why we start with general x-ray, because it's cheaper and we can see if it's necessary to actually do the MRI. This patient has a mass in the surgical neck of the femur. So here's the head of the femur, and this area here is what we call the neck of the femur, the surgical neck. So you can see this mass, this dark area right here in the femur. This is a breast cancer. Remember last module when we talked about MRI imaging of the breast? So here you can see that cancer or mass right here in the breast tissue. Again, not usually done as a first line of defense, but if they see something on the mammogram, then they'll follow up with MRI sometimes. This is just kind of a funny picture. This is actually a frontal view of the face. So you can see the eyes here, the brain, the mouth, and then the sinuses in the nasal cavity. It just kind of is a creepy looking image a little bit. This one always makes me laugh too. This, I don't know if you can tell what this is by looking at it. I'll give you a second before I tell you, but you can see the eyes here, nose here, mouth here. This, and then as you're cutting through, here's the brain. This is actually a pug dog. So you can kind of, now that I've said it, it kind of looks like a little pug, doesn't it? This is a pregnant mother. Imagine seeing that scan come up. So you got the little baby's brain, the eyes, nose, and the little mouth here. It's really neat to know that we can image that, but when that first pops up, you're like, oh, it's kind of creepy. And this is just another still image taken of mother and baby. So there's actually some scans that float around the internet that say that they can show love in the brain. I did a little research on it and I couldn't find any validity in the actual image, but this image itself is real. There's a lot of times where if they're trying to scan the baby, the mom or parent will stay right in there with them. And I believe with this one, the MRI tech just seen the opportunity with the mother kind of kissing the baby and thought it would be a neat image. But I do have an MRI of a baby in the womb and moving around. That's kind of cool. I'm going to show you the video here in just a second. All right, let's go ahead and start this. So this is just the baby kind of moving around in the room. Let me put some little music with it, sorry. So you can see it turning its head, moving its legs, its feet, arms. And tries to like kind of almost stand up or stretch out. And then it just kind of repeats itself. But I think it's really neat to be able to see that baby moving in there and see the structures within. All right, so if you have any further information that you'd like to know about MRI, these are some resources that you can go to. The Society of Magnetic Resonance Technology, the ASRT, which is the American Society of Radiologic Technologists, or the ARRT, which is American Registry of Radiologic Technologists. I highly recommend that you go through and take the Kahoot prior to taking your test for MRI.